So, hi everyone. Thank you for joining me and Victoria today for Sarah Speaks Mental Health in Fashion. This event is running in conjunction with my online virtual exhibition, Deaf Over Time Part 2. I recently announced earlier this week that it's been extended for 2 more weeks, which is fantastic. We've had so much support. And yeah, lots of people have been tuning in, which is just fantastic to hear. So we've decided to keep it running for 2 more weeks. Hi from Cornwall and hi from Mexico. It's great to see familiar faces from Mexico again. That's lovely. Yeah, it's great to see familiar faces and new faces. So yeah, these talks are running in conjunction with my online virtual exhibition, Deaf Over Time Part 2. This online exhibition is very immersive. You can walk around yourself and go and explore pieces of artwork. And the garments that are on show are from my mental health collection, which represent specific mental health conditions. Both my exhibition and this event of series of talks is kindly funded and supported by A Time to Change. So hello everyone, my name is Sarah Hollebon. I am a fashion designer based in Carnaby, London. My brand raises awareness of social issues that are happening in the world. I'm currently focusing on areas of mental health, trauma, and sexual violence. A lot about my brand is that when we go through creating the collections, we interview people who have gone through these specific social issues. I do believe that interviewing people is the most factual form of information you can get. And you know, we're discussing very serious and sensitive topics, so the more information is the best, really. I'm also a mental health activist in my spare time. I volunteer for Time to Change, and I'm also a public speaker through the Speakers Collective, who are a collective of speakers based in the UK, and we give talks on a broad range of subjects, whether it's mental health, physical disabilities, or mental disabilities. It's a very wide spectrum. So like I said, I'm also volunteering for Time to Change as a champion. We are doing this event in collaboration with them. Time to Change is a mental health campaign based in with the objective of reducing mental health related stigma and discrimination. I am part of the Time to Change Kingston hub, who try and reduce stigma locally in Kingston. So just to start off with a general health warning, we will be talking about serious and sensitive topics, including medical trauma today. And as we don't know your background or how you're feeling at the moment, we need you to know that me and Victoria are going to be as open and honest as we can about our experiences. And we don't know where the conversation is quite going to go. So that means that we need you to be very aware of your own personal vulnerability. And we need you to pay attention to how you are feeling. And if at any point during the talk you begin to feel anxious or distressed by what you hear, then please do log out and take a break for as long as you need, and you can rejoin at any time should you feel ready. If you do need support, you can call the Samaritans on 116 123, or you can text shout to 85258. We are going to be adding signposting in the chat for UK services, Mexico, and Sri Lanka. As we've had like previous people turn up for these talks from these countries. There is lots of help out there, so please do look after yourselves and reach out if you can. So just another reminder, just to keep everything running smoothly, if everyone could keep themselves on mute, that would be fab. Right, so welcome, Victoria.
Hello.
Hi, how are you feeling?
I'm good. I'm a bit achy today, but other than that, I'm all good. I've had a very varied week, but I like it that way.
Good.
So
yeah, that's good. We like it varied, definitely.
Yeah, definitely not the same thing every day.
Exactly. That really helps as well, especially when we're in lockdown, you know, changing it up a little bit can really help with our mental health.
Definitely. How are you today?
Oh, I'm good, thank you. I'm good. I'm very good. Yeah, can't complain. So I met you, Victoria, online back in the first lockdown. We both joined a weekly group session organised by the incredible Alison Lowe. This group consisted of a wide variety of people in the fashion and clothing industry. These sessions were amazing as it helped lift my spirits up during the first lockdown, and I'm sure it helped yours, Victoria, too, and the other people.
Yeah, it felt like you were still connected to the industry, even though things had sort of ground to a bit of a halt. It was nice to have that like base of people.
Yeah, exactly. And it was nice that it was like on the same time, on the same day. It kind of created like that sense of routine as well when everything was
the routine of it was so helpful.
Yeah, it really was. And yeah, so although we're not doing the sessions anymore, I've still kept in contact with the majority of the people, including yourself. And yeah, it just feels a bit weird because I feel like we've already met in person because we've spoken so much since we've met virtually, but we haven't.
No, we haven't actually met in real life.
I know. Like, what even is that anymore?
Yeah. Well, I mean, hopefully this year I get to be in the same room, like physically, and speak to you. That would be nice.
Yeah, definitely. We will definitely plan it when the time's right.
Yeah.
So I don't think I can really give justice to your introduction, so it would be great to hear you give a brief introduction and tell us a bit about yourself.
Okay. So my name is Victoria. I am a adaptive designer. I own a company called Unhidden Clothing that makes socially responsible fashion for people with disabilities. I'm also a disability advocate, and I'm a brand ambassador for Models of Diversity, who also champion for inclusion in the media, beauty and fashion industries. My day-to-day life job is as a garment technologist, which I do freelance, but that's been quieter, which has given me the time to launch Unhidden, which I finally did in November last year. So it's only been open for 3 months. I have myself a number of invisible disabilities. They're all gastrointestinal generally. I mean, one of them is to do with my ribs, and that's costochondritis. But yeah, I have all sorts going on there. And that's kind of that journey into disability is what started me also on down the path to starting Unhidden.
Amazing.
That covers everything. You know, and I'm like, oh, there's probably something else. I was making masks, I think, last year when we first started speaking, and I still sell some of those, and I actually still sell the clear ones probably the most for people that have hearing loss and need to rely on lip reading.
I thought those clear masks were incredible when you brought them out. So are you selling them through Unhidden, or
that's actually through Etsy for now, but I'm trying to sort of put everything into one place because it is quite hard work, like trying to update several different places at the same time. But for now, it's all on Etsy.
Amazing. Well, yeah, looking forward to seeing when everything brings it all together.
Yeah.
Yeah, well, thank you so much for the introduction. That was amazing. So first question, do you think physical disabilities and mental health can overlap?
I mean, I think they are inherently intertwined. I think it's a huge thing that people don't necessarily always put together. But I mean, I think that will change over time. I think the problem for now is that having a physical disability, you are sort of put into a situation where you are at such a disadvantage that it's going to affect your mental health, no matter like what you do, because it's a daily frustration and a daily coming up against obstacles and barriers. And I mean, especially also to do with any disability that you're not born with. I think if you are non-disabled and then you have that taken away from you, that obviously has a huge impact on your mental health. And then people like me with chronic health conditions, you kind of have that constant cycle of grief as well, where you keep mourning for who you used to be, and then you might have a period of remission and you feel a bit better, and then you go back. You know, like at the moment, I had a pain injection in July last year for my rib condition, and I've been able to move a lot freer, like not been in nearly as much pain. And then the last 2 weeks, I've realized it's wearing off, and I've suddenly realized exactly how much it was holding me back before. So I'm like, great, I've got to get used to that again. But I've got an appointment to have the same thing done. So like it will come back, but it was still kind of a weird shock over the last couple of weeks of going, oh yeah, I couldn't go and do the shopping, couldn't carry anything heavy, like certainly can't be knocked by anybody else unless I want to be in a lot of pain for the rest of the day. So yeah, they're absolutely completely linked. And I think the other difficulty people have is with people like me with invisible disabilities, if you admit to having any kind of mental health problem, it is very, very common, especially if you're female or female identifying, to then have your health issues kind of mixed up with mental health issues, like, you know, with endometriosis, for example. People take 7 years to get diagnosed with that because doctors like, oh, it's, you know, it's in your head, it's stress. And I had that with my stomach issues. I was going in for years saying there's something wrong, and doctors were just saying, oh, you know, it's, you're too young for it to be anything serious, you're female, it's probably just stress related, maybe you need to calm down. And if I ever actually said, actually I am feeling quite stressed, then they, you know, any new symptoms they would attribute to a mental health problem rather than a physical one. So it's really, like, it's such a weird dance you have to do to sort of get the right help for your mental health and not have it interfere with your physical health. So it's a huge topic. I realized I was going to go on for a very long time.
Wow, that's yeah, you've just taught me a lot as well. Like I didn't know that about a lot of the stuff you just said. So going back on the first bit where you said about how some of the I guess disabilities that you've got aren't always there. So like you can go through periods of it not being there and it's fine, and then suddenly it just comes back again. Like I never even realized that that could happen. Maybe I'm just not that aware of it, I don't know, but that could be quite like a big shock, because it's like you're getting used to like feeling back to normal again, and then it can like hit you.
Yeah.
Or also like realizing that you don't have it anymore, and then it's gone. So yeah, it's like a bit, I can imagine that could be quite a shock.
Bit of a dance. Yeah, I mean, for some, I mean, I usually refer to it as flares, and there's certain things that trigger that. With me, it's quite often food, but then there are some cases, you know, some people do manage to get over some of the things that I have and they never have them again, but they always have it at the back of their mind that it might come back, you know. So it's, yeah, it's really tough. I mean, most of the stuff that I have isn't curable. It will be there to some degree for life, and some of them are a bit degenerative. So I kind of try and be like, yay, you know, I just enjoy what I've got for now, because it might become less. And I would say, I mean, even from when my first sort of big medical incident in 2012, I was a lot more mobile even after life-saving surgery than I am now. So it has been sort of a slow drip, sort of having things taken away. And then you sort of look back and I realize I still went out dancing then. I definitely couldn't do that now. So it's, you know, it's yeah, it's definitely an up and down sort of roller coaster, I would say.
Yeah, I can imagine. And then also going on about what you were saying with the doctor, I mean, I can imagine that's extremely frustrating.
Yeah.
Do you think they say that because they're not even aware that it can happen to younger people? Like, is there a lack of education on their part?
I think there's some of that. I think there is some inherent medical bias, though, that's a real problem. I mean, I've seen it so much with so many people that have a lot of the same things as me, that have reached out and sort of said, how did you get treatment? How did you find out about this? Or what doctor is it and what hospital are you at? Because they've tried everything and they haven't got any further, and they're still having doctors say there's nothing wrong. So, I mean, I say to them now, it's a really good tip for anyone. What I say to them is, if you go and see a doctor and they sort of try and say something like that, and you've seen them a few times, you've tried the wait and see, and it's not, things haven't got better, then just say that you want them to write on their medical notes that they have chosen to take no action. Because I promise you, most doctors don't want to write that down. Like, they don't want to write that. So that usually, I mean, that's got me tests that then diagnosed something in the past. So like it's handy to sort of have in your back pocket when you go and see a doctor. Just say that, because they will then take it a bit more seriously. But it's taken me years to get to a point where I can advocate for myself, because, you know, you're so used to, you believe the doctor, they're the doctor. But, you know, whenever I see a GP, I mean, now when I see a GP, they're usually scared of me. But because they're just like, oh, should you just go to the hospital? But, you know, it's that, especially when it comes to chronic health conditions, they're things that we live with. No one knows your body better than yourself. So it is really annoying to go in and say something's wrong, and a GP that have to, you know, they have to specialize in everything, but obviously they're not going to know the ins and outs of really, really specific conditions. So I feel for them, and it must be, if you see 20 girls in a day all saying the same thing, it's very unlikely every single one of them is going to have endometriosis, for example. But it doesn't mean that they shouldn't be checking every single person properly. If you go in with a complaint, they should do something to resolve it. So I think it's yeah, I think it's a combination of the two.
Yeah, I completely agree. I can imagine it is hard in that sense, seeing multiple people this, every day. But you are right, like they should still give full checks just to check.
Yeah, because
Because
it's not the patient's fault for who they've seen in that day that's complained about the same thing. It's if patients come in with a complaint, you should try and fix it. But
exactly.
it's difficult.
Yeah, but that's a great tip about saying to write it on the notes. I love that. That's
I mean, my
really
specialist, she looked horrified when I said that to her, but it worked. So she listens to me a bit more now.
That's great. It's good to know those kind of tips though, because like you said, you go to the GP and you believe what they say. So you're like, oh, then maybe it's not that big of a deal. And then obviously, things still manifest and develop. And
like if it's still going on and you're like, okay, well, is this just, does everybody feel like this then? Is this what life is like for everybody? And then, things escalate and you're like, I'm pretty sure it's not. And then, and then you start questioning yourself. So it's probably the most horrible version of medical gaslighting, I think, that does happen quite a lot. And I think doctors are probably the worst for doing it.
wow. So this is actually following on relatively smoothly with my next question. Have you experienced stigma or discrimination in the fashion industry, whether it's around mental health or your disabilities?
Yes, I would say it's probably been around both, actually. I mean, the earliest example was one of probably the third job out of university. And they'd taken me on knowing that I just had this big medical incident. And as far as I knew at that time, I was going to get over it. But that something had happened and it might rear its head. And then it was a very stressful job. I did get sort of sicker and sicker. And eventually they called me into the office and said, we accept your resignation. And I was like, I haven't given you one. And that was the end. But what had happened the week before was actually the stress of it had got so bad that I basically started having panic attacks as well. So while they'd been sort of tolerant of my physical problems, as soon as I said that I'd had a panic attack, I remember the boss saying, oh, I don't know that this is going to work. And then a week later, I was out the door. So I was like, I'm pretty sure it's not legal. It's not legal, by the way. It's not. So yeah, that's happened. I mean, I've lost a few jobs or contracts, even while being freelance. I'm quite upfront and say I have chronic health conditions. They are managed. But there are times, and I'm not in control of those times, there are times it will get worse. And some of the places I've worked have been amazing, and they've said, why don't you just come in a bit later, finish a bit earlier, so that you're not being knocked about in rush hour, especially if they were quite far away. So some places were really good, and then others were they were good to start, and then they were understanding at my time off at the start, and then when it continued, it was the same. It's not like the amount of time off suddenly increased. It continued, and then I think there was kind of this whole, oh, she really isn't going to get any better than this. Like, she really can't give us any more time. And there was a lot of, they were just like, well, you can't work from home, which the irony is not lost on me of the last year. But that was probably the biggest reason I've always been given from every company was, you can't work from home. I was like, that was the one thing I really needed. And it is a reasonable accommodation as well. So yeah, quite a lot of stigma. I mean, I think the difference is, though, I don't look sick. I'm told it all the time, so I'm very aware of that. But I know that that's also been kind of a good thing. Like, in terms of if I go to an interview, I get the job because I don't look sick. So even if I say I have a chronic health condition, they're just like, no, that's fine, no worries. Because I think they assume I'd look a lot sicker if it was more serious. So it's been one of those, it's been hard. I think if I had a visible disability, I don't think I'd even have got an interview at any fashion company with a visible disability. I don't think they hire people like that. I don't believe.
That's interesting, actually. Yeah. So you've never seen.
Never seen.
I haven't.
Never seen that on in any company. And half the buildings I've worked, actually, I say half, all of the buildings I've worked in all had access issues anyway. So if you were a wheelchair user, I don't think you'd physically get in the building, never mind get hired for a job. But I think if you said you were a wheelchair user on an interview form for a fashion company, I just don't think they'd even call you.
Yeah, you're right.
With any reason they like for why you don't get that job. But I think that would be a big reason.
That's a good point, actually. I mean, some of the internships I've gone to, they've been in like buildings where it's lots of layers, sorry, lots of floors, and they're like storagey kind of compartment things. They're not actually a storage
Yeah,
compartment,
they're
but
like units, but yeah, they
units,
feel
yeah.
like, yeah.
And
I know
I
what you
can't
mean.
really imagine a wheelchair user going through them, the ones that I've got interned at. So that's a really good point.
Hmm.
Um, it's awful about the whole resignation thing, and
Yeah,
especially
it was
linked.
disappointing, especially when it was so early, like on in my, I think it was only the third job out of university as well. So, I mean, that was about 5 years in, but I was still, quite young, was still kind of getting used to being sick myself. And I didn't know any, I was far too scared to sort of make it legal and turn around and say, you absolutely can't say that or do that. But even now, when I know that I can, it still happened. I think it happened a couple of years ago, and they said, we need someone that's going to be here 5 days a week, and you can't do that. And I was like, I can't, you can't have an argument and have a legal case with every single place that you work. So I was just like, fine, I'll just remember it. So I just remember these people.
Of course, yeah, you don't.
And then I just go, I just wouldn't refer, them to anyone.
Exactly. That's a really good point. Yeah, I mean, it's hard as, yeah, because like, especially when you're young, you might not everyone has confidence at a young age, it's something that we develop, and because we go through experiences, right? So that I can imagine it can be really disheartening and make you maybe think about like, what's wrong with me, but like there's nothing wrong with you, it's what's wrong with them. Like, and like you said, the irony is that everyone's working from home now, so it's like that just wasn't really a problem.
No.
Yeah, I think if you, I think people can work around people's things that they've got in life. People can be flexible, it's whether they want to be flexible.
Exactly. And the thing is, we're flexible around parents with their children, and that they need to work part-time and have slightly unusual hours. I'm like, that's usually all that people with disabilities really need, is just slightly different hours, or for your physical presence not to be a prerequisite of the job. I mean, I think the insidious thing that I had happen at a couple of companies was, I could tell the moment when they decided my health was a problem, suddenly they were finding problems with my work. And it would be a real slow drip feed of, this was wrong, you haven't done this, why haven't you done that? And it was so that the case was more that my ability was the problem, not my health. And it happened twice, and I did have to take a legal route with those things. But that's something to be aware of, maybe if anyone is in the fashion industry. Like, I always had, I'd write down any incident where I felt it was an inappropriate sort of response, or there was a reason behind why they were acting or behaving a certain way. You can keep a track of it, and then you can prove it. And I mean, when I've been able to then provide all this evidence, it's been in my favor.
Yeah, that's a great tip. And that's very insidious. Is that it happened twice at what, 2 separate jobs, or was that
two
the same?
separate companies?
Wow.
So I learned from the first one what to do at the second one. So I was like, right, I remember this feeling. You have a gut instinct, when someone suddenly they're one way with you one week, and then the next week you're like, someone's had a meeting, they've decided something different, and they're now going to, are they going to try and make me leave of my own volition by making it an unpleasant place to work, which is what the first place did, or just kind of really try and build a case that you're not good at your job.
That's awful. I mean, both areas are awful, and it's very insidious, because it's like something that's like quite planned,
it's really hard to improve, to prove something really simple, like kind of, why haven't, even just being CC, suddenly finding other people CC'd on your emails that aren't normally, and you're like, why are they all there? And then like, especially when it's flagging like something like a spelling mistake, and you're like, we're flagging spelling mistakes to each other now, like, do we need to do that? Like, it's really, really small and stupid, but it's effect, like, it has an effect.
Of course it does. Yeah, of course. Completely. It would create an effect on me. Very petty. That.
Yes. Yeah. But then, I mean, I've worked in another place where they were absolutely amazing about everything. I had time off for surgery. I had full pay, and then I came back and left and went to another company because I got headhunted while off. But somebody there, like, they were still someone on the team. She was just not very nice, So like, but everybody else there was lovely. And you're like, just one person really can ruin it for the rest. But I'd say generally, like, I do have a really positive experience in the industry, but it's just been this sort of the downside being with my health, that some places haven't been great.
Yeah, I think it's good. It's important to know that, you know, we both had great experiences in the fashion industry, but there is also elements of some experiences haven't been good. And you know, it's good for people to be like aware of that, I think. Because then it can be very hard to be in that kind of situation, and it takes you by surprise or takes you by shock, and then you might not have the confidence or the courage to like stand up for yourself, and then it can really create an impact on your mental health and also your physical health, like in your instance as well, you know. And the things that you were asking for, like, I don't think they're really a massive deal. I like you said, the people who have kids, like, they might come in at different times, and that's kind of what you're asking for. So yeah,
the thing is, like, nothing was ever late, you know, like it wasn't like I was missing deadlines and missing fit sessions. I mean, don't get me wrong, I did miss the occasional fit session, but I'd always make up for it the next week, and
right.
you know, there was never really a problem, but it was always that kind of, oh well, you know, you're not here. I'm like, the work was done, like I actually had nothing to do. I'm not saying I don't have a job to do, but you know, I had run out of things. So so you know, you'd be like, what's really the problem? And then but swings and roundabouts. Some places are really good about it and some places haven't been, and that's been the same in permanent roles and freelance roles, I found. So but it is like, it's much easier for me now to work for myself. I think I've been ruined now to work for somebody else.
I think, yeah, I think working for yourself is a great thing to do, if people are able to do it, and if they want to do it. Of course, you've got to want to do it.
I mean, no one else is going to chase you out of bed. It's yourself has to chase yourself out of bed.
Exactly. And I think sometimes, although those experiences are awful that you've been saying, and it's not right in a sense, in a way, it's kind of, it's not good that these things happened, but it shows you who they are, right? So you don't want to be working. Why would you want to carry on working for someone like that? So it shows that you know, these aren't people you want to work for. So you can able to, you know, move on to someone else, or you know, start your own brand like you've done.
And it does those, the personalities that go for that kind of behavior, I can spot them now. So if I and I can choose whether or not to work with freelance clients. So if I meet someone, I'm like, I think you would be very difficult, then I don't have to work with them, and I can just say I'm not available, and then I don't have to worry about it. But I would say you can usually tell who they are. If someone gives you that kind of like, there's a bit of you sort of have that hesitancy, like, there's something there.
Oh yeah, and your gut is a powerful thing as well, isn't it?
Well, I don't know about mine, but
well,
the metaphorical gut is very strong.
Yeah, metaphorical. Yeah, well, yeah. I think it's great to be able to like pick and choose as well who you want to be working for, because like you said, like, why would you want to work with someone who's super difficult? Like, that's not going to be it's not going to create a really powerful and beautiful end result of the work, is it?
And I think people need to, I mean, I think it's probably, I don't know if you've experienced this, it's my experience in the fashion industry, people are the most unprofessional I think I've ever come across. Like, if you're in a corporate job, you would not be allowed to speak to people that way, behave the way that some of the managers do. You know, I'm just like, I don't think you can do that in the real world. I think in the fashion industry, it's kind of a given that someone's allowed to be a bit bitchy, for example. But that's, you know, I actually think, like, in the real world, I don't think you're not supposed to treat other people like dirt immediately, as is kind of, you know, it's almost okayed in the fashion industry. I don't know what your experience has been like with that, whether you've
like that. That's a really interesting point. It has become like normalized, isn't it?
It's not until you step out and like work at a company completely nothing to do with fashion, you're like, oh, you're all nice to each other. And everyone's enjoying it, and no one's trying to beat the other person for a promotion. Like, it just, and we all speak to each other like politely and professionally, not, you know, it's really interesting to me to like, just see, sort of go, oh, I don't think we don't speak, like, we don't even behave how companies should behave in the fashion industry, I don't think. So it's good, because I know what I don't want to do.
Exactly. And also it shows that, you know how to treat, you know, your employees when, like, in your brand, you know. I think that's a really powerful thing. I mean, that's because I've experienced some things like that, where people have like been shouting or like screaming and over like bizarre things. So yeah, I have seen it quite a lot. and I've also heard a lot of people who've mentioned it too. So yeah, it has become weirdly normalized, and it can become toxic, very toxic environment for people to work in.
Yeah, definitely.
And the fact that it's become normalized is very troublesome, I think.
It's really problematic. I mean, I don't think I've worked at one fashion company yet where someone hasn't eventually also been signed off, for like stress or, depression, because they've had to endure this awful environment for so long, and then they're just like, do you know what, I'm out, can't do it. I know I've got a few friends actually, they've all at some point they've had time out for that reason.
Oh yeah, I left an internship once because my mental health just went completely downhill. Like the way I was treated, I was just like, I have to just leave. Yeah, that wasn't good. I was having like breakdowns like every night.
It's the thing,
And
you get home and you cry and you're like, job shouldn't make you cry every night. That's not normal.
exactly.
Well, not that there's much of a normal, do you know what I mean? But yeah, I think I remember like sort of trying to coach one of my friends to leave a position, because she was the same. She'd phone me in tears, like in the loo, and be like, you should not be crying at work. Like nobody's died. This is dresses. Why are you crying in a toilet at work? This is ridiculous. But yeah, it's awful to witness, because it's really hard, because it's your job and you care about it, and it's in an industry where you're sort of led to believe if you complain at all, you'll just get replaced. So everyone kind of accepts that really bad behavior from superiors, and then you just think that's how you should behave. So then as they go up their career tree, they behave the same as their terrible managers, has been what I've sort of seen as well. And then you're like, no, we've got to come in and be kinder.
Exactly, we've got to break the chain.
Yeah.
The chain. I completely agree. Yeah, because yeah, if you're in that environment and you think that that's the way it's meant to be, then you may carry that on too. Yeah, yeah, people shouldn't be crying at work. I completely agree. And yeah, it's hard because it's like, it's something, I think when you're in fashion, it's something that you really, really love. Like you've got a lot of love for it and you really want to be doing it all the time, and you've got so much passion for it. So you do end up putting up with stuff because you want to be in that position, and it is that fear of being replaced quite quickly, because it's a very overpopulated industry. So a lot of people can just come in, especially if you're an intern. I think
Yeah,
they can just get an intern.
I mean, interns. I remember I used to dream about like starting like a house, like a sort of commune for interns, where they'd all be looked after. There'd always be a bed for them to sleep in, didn't matter what time of night they got in from whoever they were working for. And someone that would mediate. I was just like, all the interns need a hug. Because it's such hard work. And like, I think my first internship out of uni, it was 7 months. I think it was 7 days a week. It was quite often like 8 a.m. until 11 p.m. Sometimes I actually slept on a mattress in the studio whilst the designer went home. And you just think, why do we do it? And we don't turn around and say, actually, no, you need to pay me for this. Because then they just say, all right, see you later, I'll get someone else who will do it for free.
Exactly. Yeah, I wish I had a hug when I was an intern.
It just needs someone to go, guys, it will be okay.
Oh, that's so funny. But yeah, I think it's like being able to develop that confidence and to realize that this isn't right, this isn't healthy. Yeah, but we're creating brands, and we're not going to let that environment happen. So and we've seen other brands as well that are more healthy, and I think it's a lot with the younger designers. Like I do feel like
it's changing.
Yeah, definitely. But yeah, all about that hug, definitely.
Yeah.
Maybe not right now because of COVID, but when that ends, something to look forward to. So do you think individuals working in the fashion industry are particularly high at risk of developing ill mental health?
Yeah, I think it is. I think it's more commonplace than people realize. I think because like we've covered like and touched on, there's work pressures, there's pressures to accept how you're treated because otherwise you'll be replaced. It's predominantly female workers, but with male management. And I think that has something to do with it as well. Like there's a weird patriarchy in fashion. I mean, all the guys with all the gates and all the money, it's all the men. So I think some of the women therefore kind of feel like they have to compete, and they kind of go a bit over the top. And then they're still usually the ones that end up burning out. I think burnout in the fashion industry is a huge problem. And weirdly, another one, and I hope this doesn't upset anybody in the audience, but I have noticed it's pretty much every place I've worked at, there's this unhealthy eating issue as well, especially in the higher fashion places. There'd almost be like a daily competition on who could eat the least in the office. And you could sort of, you could see people like they just put a salad in. And I'd be like, I know that's you. Clearly you are eating when you go home, because otherwise we'd all be dead on our feet. But like, why there was this weird, like, who could eat the least things sometimes. I'd be like, that's, I think, was also a big problem. Or like sizing in general is a problem in the industry because it's incorrect at almost every single brand. So we don't even know what size we are. And then we feel bad that we're not whatever silly size we think other people are, even though they're not. So I think that as well, like it's really easy to fall into, especially I think amongst interns, and when you're in your younger career, if you're working at a company where everyone's behaving that way, I think it'd be really easy to fall into some disordered eating habits and not think anything of it, and then just not realize months down the line, and the problem is it gets reinforced, because then everyone's like, oh, you can wear the sample size. So like there's this horrible positive negative reinforcement of sizing as well. So yeah, I think it's really easy in the industry, unfortunately. I mean, I think it is true of pretty much every industry, but I think in fashion it can really hone in on insecurities.
Definitely, yeah, and it's a really good point about encouraging the bad eating habits and the bad sizing that you said, about offering like the sample sizes. Yeah, I never even thought about that, but it's so true.
Yeah, I mean, I used to try stuff on for the first proper like paid job. I used to try stuff on for them, and then if something came in tight, rather than it being measured and being proven that the garment was smaller, they'd be like, well, did you have a big lunch? Maybe you shouldn't have eaten it. And I'd be like, I'm not actually a fit model, by the way. I'm here to be a pattern cutter and a garment tech. But if you're going to complain about my size and then start then I think they suggested it once. They were like, well, maybe we should weigh you before fit sessions. I was like, no, and here's my resignation. Like, I did leave that job because I was like, you can't do that to people. But I saw a new intern that had just started there, and they would either try on me or on her, and I could see that it was starting to bother her. And I was like, you can't say things like that in front of people, because number one, it's not my job. If I was a fit model, fair enough, within reason, you do expect me to be within a certain set of measurements. But your first response, if I say something is tight, is not to question my size. You check the garment. That's ended up what pushing me into being a garment tech, more so than the pattern cutting.
That's interesting. I didn't know that. In terms of what made you go into that area, that's really interesting. Yeah, that's really awful. That for your first reaction and first question to be like, well, what did you eat? Like, I can't believe people actually said that to you.
I know, well, that's the thing. It was just so kind of as if it was completely okay statement, and you're like, is it okay? And then no one else is saying anything either, and you're like, okay. So we're all just going to let that statement sit there, are we? I mean, it was, it's one of those things, and it's not okay, obviously. But I don't think they do it now. At least I hope they wouldn't. They are still open and running, so they haven't upset too many people.
Well, let's hope they still don't say that.
Yeah, fingers crossed they don't.
Yeah, and also it's funny because you're not even a model, so it's like you're there to be doing like the pattern cutting, so it's like
yeah, exactly. I'm like, I'm sorry, you don't get to dictate my lunch because you want me to try stuff on. Like, I'm sorry, I'd rather focus on the patterns, thanks. I just won't, like, and that's the thing. I'd say, look, I just won't do it then. And they're like, oh, we'll need someone. I'm like, we'll pay for a fit model then. Like, pay for someone to actually be bothered about what size they are every day, because that's sort of part of the job. But don't expect it of your staff. That's not okay.
Yeah,
that was, I say it was late noughties, because it was like after I graduated. Okay, a long time ago.
No, that's good to know, like, kind of when that was, though, just to give a bit of an idea.
This is over a decade ago now. Oh dear. Yeah.
Wow. Well, thank you so much for sharing that. What kind of, I mean, we kind of touched on it anyway, but what kind of pressures have you experienced in the fashion industry? Do you have anything more to add to that question? I know we touched on it a little bit already.
I think the only other, well, we have touched on it. I think the only other pressure is the time that you're expected to give. You know, they might give you a contract hours of, you know, like 9 to 5 or whatever. But there's that weird little bit of, but they like the people that go in early and stay late. You'll find those people get rewarded a lot faster and promoted a lot quicker than people that have a life and go out and do things, you know. So I think I felt that pressure a lot, which with chronic conditions meant that I felt I had to be twice as fast as everybody else, twice as good as everybody else to prove that my health wasn't a problem. And then to also have like to still try and compete with that sort of time frame. So like I do it for 2 weeks, you know, and then end up having to have like 3 days off because I was dead, you know. So yeah, there's a few little weird pressures, I think. But yeah, there's sort of the competitiveness, I think definitely, like I felt that the whole time and still feel it now, you know, people will still be like, so, you know, what are you doing? Is it successful? And I think it's that measure of what do we call successful? For me, it's, I mean, to be fair, in the last year, it's been, I have worked a bit too much because I live at work now. But, you know, it's that kind of balance of work life, which before I think I started to got quite well. So for me, like being able to switch off and have time off when I want to have it without having to put it through anybody else, that for me was, you know, meant I was successful.
Yeah, and at the moment it's very hard to switch off from work when you're living at work, like you said.
Yeah.
It's very hard to. Yeah, I'm fortunate that I'm working from home at the moment. But I'm fortunate that we've got like a spare bedroom, so I'm able to work in there and then sleep in a different room. But I appreciate not everyone has that. So it's finding the ways that work for you, because it can be very hard to switch off. And then also when you're running your own business too, just in general, it's hard to switch off from that as well.
Yeah, definitely. I mean, that's the thing. I mean, that was why lockdown was a gift and a curse for me, because not having to commute, suddenly I had loads more energy, so I could do loads more work. But then, you know, yeah, obviously, and then we couldn't go out, you couldn't go and do anything, you weren't being distracted by family or friends. So then I was like, okay, I really just don't do anything apart from work. So I've got better. Like I think we've all found a bit of a rhythm for lockdown 3, kind of have like got better routines and got better at self-care, I think.
Yeah, first lockdown I was like, oh well, I'll just like work every day, that's fine, I can. And then I was like, oh no, I'm actually really burnt out now after a few weeks. I remember we talked about that in our group sessions a lot. So that was really, it's really good to know that other people were in the same boat, you know.
Yeah, I think definitely everyone's feeling that hustle sort of, you must be doing something, you must be seen to be productive, whether that's baking loads of banana bread or whether you are actually just doing loads of work. It felt like a lot of people were still trying to do that, and it really didn't matter. Everyone just should have done what they needed to do.
Exactly. Which putting that unnecessary pressure on yourself can be really unhealthy. You know, if you want to just lay in bed for the day and not do much or just read a book, like that's totally okay. You know, we're
I
going
think
through
everyone should do that at least once a month.
That's true. Yeah, we should during the week, definitely.
Yeah.
And then also, I can imagine that was really hard for you, putting pressure on yourself in order to be quicker, so you're able to like stay on par with the other people who kind of like would stay late and arrive early. Like, you know, that kind of pressure you put on yourself can be really, really hard. And then also with your physical disabilities, you know, and if some of it might be fluctuated from stress,
Yeah,
so that
exactly.
can
Yeah.
just kind of like go around in a bit of a
So you kind of, yeah, you
circle.
end up like, you can get away with it for so long because you're running on pure adrenaline and panic of, I'm going to lose my job, but my symptoms are getting really worse, but it's fine, I'm at work, I'm here. And then you keep doing that, and then eventually your body just goes, no, you're going to rest now, and I'm going to give you no choice about it and put you in hospital. Like that happened a couple of times, and I was like, they were physical symptoms, but I think there was definitely a direct correlation between how much I've been trying to physically achieve versus what I should really have been trying to do.
Yeah, that's awful. Yeah, that's really, I can't imagine what that must have been like. It must have been really hard. And then also like, and the thing is if maybe your employers were a bit more like lenient with things, then, you know, maybe that wouldn't have
Yeah,
happened.
exactly. Some were lenient and some would be like, can you do XYZ from your hospital bed? And you'd be like, this is why I'm here, because you guys don't seem to have any boundaries. So yeah, there was definitely, there's two schools of good treatment and bad treatment. So you can always tell how good an employer is. I think even just with like trying to book a dentist appointment, I think if they're funny about it, like some companies I'd be like, oh, I need to book this appointment. And they'd be like, yeah, of course, just book it. Why are you asking? And then other companies would be like, well, no, we have to clear this. You can't book it until it's gone through XYZ and HR. And I'd be like, you do know how the NHS works. Like, I'm not in control of when these things get booked. But yeah.
Yeah, it's finding those small little weird things that happen, and then you're like, okay, maybe this isn't for me. And being able to also just come to terms with that with yourself as well is a big thing, isn't it? And then being able to leave, really important.
And then I think generally just accept that there are other companies that are good. So like even if you have to leave one place, it doesn't mean you're never going to work. Like it's not like you'll never work in fashion again. Like you will find a company of nice people. Like
exactly.
So I think it's that, I think people need to lose the fear of losing their job. If the job that they have is making them feel horrendous, then it's not really a loss. It's
exactly
a lesson, I would say.
And that's very hard when it's your first kind of job, or you haven't actually experienced a job where they are actually kind to you yet, because it's hard for you to really even fathom that in your mind. So but once that you are able to get over that hurdle, then you can become a lot more happier and healthier in yourself and really enjoy fashion to all degrees. I'm aware of time, so maybe we could go to the Q&As now. If you're happy with that, Victoria.
Yeah, of course. Yeah, I mean, I can talk endlessly, so I do apologize.
No, my gosh, don't apologize. Everything you're saying is
I always say
incredible.
I always waffle on. I can, my partner's always like, you talk all the time. I'm like, I know. And loudly.
That's why you love me.
Yeah, I'm like, yay, I talk at you for hours.
Oh no, it's amazing. It's just so important to hear your experiences, like I
if it
was not aware of a lot of this.
Then it's good.
Exactly, it is. So question 1, have there been any organizations or individuals where you have experienced empathy and felt supported? If so, how have they shown this, and what impact did that have on you?
Yeah, so there was definitely, I mean, usually people on the team would be good, but I did have one technical manager. She was amazing. As soon as I explained everything to her, she was like, okay, what do you need us to do? I'm going to set you up with, I can't remember what they call it, but you go and see an occupational therapist and you talk to that occupational therapist and they give their recommendation to the company. So they set all of that up. I went and did that. And then basically the only accommodation I was really asking for was to, not every day, but some days if I needed to come in late, for it to not be a problem. So that just meant they had to make sure any fit session I was booked onto was between sort of 12 and 4 in the afternoon rather than 9 a.m. or end of the day, just so that it meant that if I wasn't in for whatever reason on time, like they wouldn't have to reschedule the fit sessions, because that was quite a pain, and obviously they were paying for models. And then they would also let me work from home. So, and it was never a problem if I said I can't come in today. She was never like, there was no, we really need you. I mean, I think there was only one occasion where she was like, I really want your opinion on something. If you could be here tomorrow, that would be great. And I wasn't in, and I felt bad, and she got a bit cross, but then she apologized. She was like, no, it's absolutely not your fault. So yeah, but I'd say that was not the rarity, but she was probably the best example. And then others, I think others would be just the co-workers, like them saying, we will help, if you feel a bit overwhelmed, or if there's stuff that, if you want us to help with your workload, because 9 times out of 10, I'd always be given the biggest most amount of work, and then I'd get through it. But obviously every now and again, I'd be like, there's too much here for one person to do. And then my co-workers would usually say, we'll help, like we'll do some, because we can see you've got too much. So yeah.
That's great. Yeah, having really good healthy co-workers to help you.
Yeah, because I think sometimes you feel like you're told that you're the burden to the rest of the team. Like that was something that used to get said. So if the team itself were like, we're here to help, we're happy to help, don't you worry about it, then I didn't have to worry about it then. And it usually meant I didn't need as much time off because I wasn't overworking or stressed out or exhausted. So yeah, it all sort of works better.
Exactly, yeah. And also a team is a team for a reason, isn't it?
Yeah,
meant to all work together.
Exactly. And and it was the same, like if anybody else had a day off for whatever reason, I'd always offer to help them. If I had free time for whatever reason, I'd always say, if you need help, I'll help you. So yeah,
that's great.
Teamwork makes the dream work is my favorite phrase.
I like that phrase. I like that a lot. Question 2. Any tips for learning to advocate for yourself that you have learned over time, either with workplace or GPs, etc.?
I think knowing your rights is really, really important. And I think it's really easy to access that if you go on Citizens Advice Bureau. Like, so I knew, and also to keep diaries. That was the other thing. Like for me, if there was ever any sort of suspicious or weird or off behavior or a change, I'd just always have it at the back of a notebook. I'd write down the date, time, what was said, who said it, what it made me feel, or what my sort of suspicion around it was. And then, just sort of keep track. I just kept track of things that way. And then it also the same with my symptoms. If you keep a diary of when you feel bad, what did you do before? What had you eaten? Had you drunk enough water? What time of day it was? That helps you again. And that's something that doctors, if you can turn up with 2 months worth of what you've been eating and drinking and how your symptoms have been, you'll probably spot your own patterns, and so will the doctors. And then it's just in your head thing. So I think it's really easy and really good to do. Yeah.
It's really good to like hear that actually works, because there have been a few times where the doctors have been like, do that to me, and I'm like, I don't know, I'm just not very good at doing stuff like that sometimes. So it's great to like hear that actually like works.
Yeah, and I think it's because they don't then say when you book another appointment, bring it with you. But if you take it with you and say, here's 2 months worth of data, then they will, they might not have time to read it all, but they will they'll flip through, and then they'll probably be able to spot things.
That's really powerful. And also I can imagine that you will begin to see patterns as well yourself, like you said.
Yeah. Well, I had it color coded in an Excel spreadsheet.
Wow.
Like good, bad, rubbish, and then different. Like it really helped. I appreciate not everyone has access to Excel, but that was how I did it, because then you could see it in color, and over, like it was easier to see it over time rather than like on pages written down. But yeah.
Wow, that's really cool. I mean, it's not nice that you were going through that, but it's the whole organization of that.
Yeah, well, that's the thing. Yeah, but I think that's where being chronic sick is a lot about being organized a lot of the time.
Yeah, no, I can imagine that. Yeah. Steve said, it sounds like agreeing effective workplace adjustments is so very important.
Yeah, and I think like if you're going into a role knowing that you need to have that discussion, I know there's a lot of, should you disclose it during an interview or not? Do you wait till the end of the interview or the beginning to sort of mention it? But I think if you know it's going to have an impact, I think it's worth mentioning sort of from the beginning, say how you've managed it in the past and then what you'd need. And then it's probably not a problem. If you go in as if it's not been a problem, they're not going to think, right, that's a problem. But I think if you're apologetic about it, like they will start to behave weirdly around it. So yeah.
That's a good point, actually. Yeah, that's a good point. And also, if you're worrying like when to say it in the middle, like it's at the beginning of the interview, in the middle, at the end, like you're like potentially like stressing and overthinking and stuff, and then that might not put you in a good mood for the interview. And also it's just not nice to put that on yourself, because it's like you shouldn't even be like worrying about that.
When you're doing an interview, you don't need to worry about that. But then I was listening to a conversation on Clubhouse the other day, and someone was saying, but if I had an interview and they were really great and we really enjoyed it, and then they dropped a bombshell at the end of they needed to be part-time or they had a health issue, she's like, I'd feel betrayed. And I was like, ooh, I mean, you shouldn't. And I was like ableist, and I did call her out for that. But it's that to me, I was like, that is kind of, it's not right that someone would feel that way, but I can understand why they would. It's like, why wouldn't you say it at the beginning? I'm like, but then would you switch off if you heard it at the beginning and say you're not going to take that candidate because they've already said something that has ruled you out? So I don't know how to navigate that very well, other than just saying, go in honest and open, and it should be okay. And legally, it should be okay.
Yeah. Also, like, I don't know if I'm wrong on this, but does it really matter when you say it at the interview? Because it's not even like you're there for that long. So
exactly. And you shouldn't have to. At the end, also, like, they have to prove that they're a good place for you to work. So I think you should bring it up because you need to know how they're going to react. And sort of, if you go at it from that point of view and sort of say, maybe, if you have to fib, I know people shouldn't, but if you can say, where you've worked before has done X, Y, Z and accommodated it, then, there's not really any reason why a new company couldn't. And I think, especially for when it comes to remote working now, there isn't that excuse anymore. They can't say it's not possible. So that's been like the one really good thing for me and a lot of my chronic sick friends is now we're like, you can't say it's not possible anymore. We had the whole country doing it. Like it's kind
Nearly
of,
the whole world.
it's got really good, it's really good for a lot of people. Like remote working is now going to make a lot more people able to work, which is really good.
That follows on nicely with the next question. Do you think the fashion industry will allow more people to work from home, since that's been proven to work over the lockdowns?
I would hope so. I think they will definitely, to some degree, they'll reduce office space and downsize in that sense. I mean, when it comes to fitting clothes, you do need to have it on a body, ideally. And like I know a lot of my garment tech friends have been doing it on mannequins, which probably means the fit of clothes coming out this year and next are not going to be as good, or there's going to be problems with them because they've not been fit on a human body. But that aside, I think, you know, it's nice to have that camaraderie, but I don't think the 5 days working in an office is necessary. And I hope that the fashion industry allows to make changes for that, even just for, you know, for mothers and for people that are carers for other, you know, for other people. I just think remote working should be more commonplace.
I think it's a tricky one, because it's like with fashion, it depends on what you're doing in the industry, right?
Yeah, it depends what you're doing in industry. Some of it is impossible to do from home. You know, like if you're a machinist but you don't have, you know, all of the fabric and all of the patterns and all of the people around you at work, then it's not necessarily going to work. But there's you know, there's accommodations that can be made. I think every job can at least have one day working from home where they don't have to be in the office.
Exactly, that's what I was thinking, because I'm going to be looking for an intern at some point, and because I'm still working from home, I was thinking, like, can this even work? And then I was thinking about ways that it can work, because if we think about ways and be flexible and open-minded, then that can happen. You know, I think some elements of sewing, you do need to be with someone because they need to show you how to do it, all that kind of stuff.
Yeah.
But there could be some more simpler stuff that you could save for one day, that you could maybe mail to them or get them to come pick it up and then take it back on the tube, and you obviously pay for the transport.
Yeah.
So I do think there are like ways that things can be flexible, but there are also some things in the fashion industry that you do have to be in person for.
Like photo shoots you can't remotely do. You do have to do.
Exactly. And fittings as well, ideally is better in person. Yeah, and then also some sewing stuff too. But yeah, I was opening my mind too. I was like, there must be a way that I can adapt a little bit, you know, so to make everyone safe and comfortable. So question 4, could you say more about how your garments are made for people with disabilities?
Yes, of course. So there's a range. I have 5 men's pieces and 5 women's pieces. There's shirts on across both genders. They have access through the sleeves, so you can, if you've got PICC lines, it's usually for people with that are going through chemotherapy or radiotherapy, or they're fed through their arm, so you haven't got to take your whole shirt off. You can access it through there. They also, for people with dexterity problems, you can choose whether they're finished with poppers, Velcro, or magnets, so you can just throw it on and it will do itself up. So that works for people with cerebral palsy, Down syndrome, rheumatoid arthritis. It covers quite a broad area. We then have a men's and women's pair of trousers for wheelchair users. So there's a longer back rise in the seat. There's all the seams are removed from the back, so there's no problems with pressure sores. It's an elasticated back waist. You can get in from the sides as well as through the front, and the excesses are removed from the front of your hip and the back of your knee, and they're longer in the legs, so that when you're sat down, it is covering your ankle, which is, you know, sort of, if you sit down in normal trousers, you will see how, like, trousers are designed for standing. So these are designed for sitting in. And it's really weird because I put them on myself and stood up, and you can feel where the tension suddenly is, and you're like, oh, this is odd, but it's quite interesting. And the trousers also, because they're elasticated and because you can adjust on the women's, you can adjust them for size. They're ostomy friendly, so people with stomas, suprapubic catheters, they should all be able to access that without any difficulty, and they're more comfortable. And then the dress has a hidden zip, so you can access a stoma without having to lift your skirt up and without having to sort of undress, basically. So that's for, again, anyone with any kind of tubes and any kind of ostomy or ileostomy. And then the wrap top for both the men and the women, you can unzip in from the front seams so that you can access chest ports, again, without having to take your whole top off. and the sleeves are all designed for for wheelchair users, so you can move your arms more. So I think that covers most things. But I'm finding there's always, every day I come across, I'm like, oh, actually, they also help for this. But they're like, I try and combine as many conditions and adaptations that would help in one garment, but they also look quite, the adaptation, you can't see the adaptations. They're kind of hidden adaptations, even though we're called unhidden. So like most non-disabled people, you probably wouldn't tell what it is that I've done, which is kind of why I have to describe quite a lot with the images, what I've done, because people don't understand, like, and also what they need, why you would need that access. But yeah, that's pretty much what they all do. And they're all made sustainably as well. Just throw that in at the end.
Yeah, you're very big on sustainability, rightly so. But yeah, it's great. I think you've got a really nice balance of raising awareness of disabilities, actually catering for disabilities, making it fashionable, and then also very healthy for the environment, because I know you take a lot of care on that element of side of things. Yeah, it's great to like hear you talk about them all as well. Like this is so you can tell that you've spent a lot of time researching all of this and taking time to really be considerate. And I think in a way it's quite good to have information explaining it. I know you have to, because some people might not see it, but I think it's good for people to see it. It's good to have that information there. Like, it's good information.
That's the thing. I know I need to update all the product descriptions, because like I did these images last week where I say like what the adaptations are and who it helps, and my phone melted. I was like, oh, people get it now. Really should have done this sooner. So now people understand what it is that I'm doing. But I think it also, that would help if I put those images on the website, which I need to, and the product description as well. But the problem with it, however, is social media and shops. They, despite constantly removing disabled bodies from Instagram, TikTok, Facebook, if I have too medical a description within the description of the garment, of the product, they won't allow me to put it as a product on the Facebook shop.
Oh,
so why? Like I think I kept saying for Ehlers-Danlos syndrome, I think I'd mentioned, and I only put it in one product description, and then it was the only one that they wouldn't allow through. So I think it comes from, they don't want people selling medical stuff to people on Facebook, but to sell it to that market, I have to explain the medical condition it would help. So it's really difficult in terms of language to communicate it without saying the problem. So now I think I just have to say what the adaptations are and hope that people understand who it's aimed at. Because if I say chemotherapy, no, it's not going to be allowed. If I say cancer patient, no, they're not going to allow me to write that. Like, they just won't show those posts. Like, the tech around it is really clever, but unfortunately it means that a lot of my stuff doesn't actually make it through.
Wow, I never even thought about that. I mean, it makes sense in a sense,
yeah, like I understand it from, because
yeah.
I've been in enough groups where someone's always trying to peddle you, oh, this cure that got rid of my aunt's husband's sister's cancer, try it, buy it, vitamin supplements. Like there's so many of those, and I think it is generally to clamp down on that. But
yeah,
the impact being, it's really hard to target the disability community through Facebook and Instagram when it's monitored so heavily.
Yeah, that's interesting. That's that's a bit of a predicament to be in.
To get quite creative.
yeah, you do have to be creative with that. Yeah, I mean, maybe they're also doing it because they're not aware of so many brands being out there catering for disabilities too, which
exactly, it's a new market that people don't target at. So I think as it grows, or as people realize that it's there, that those things will change, hopefully.
Yeah, exactly. Yeah. Oh, well, there's a few comments as well. So my brother had something similar, Victoria, but it was due to his mental health. The employer tried to build a case based on performance that was unsuccessful, and like you, he had kept a log of incidents.
Very good. I think I've had friends that sort of their mental health's been affected, and I've told them to do the same thing and said, like, especially with bullying, I think there's a fair bit of workplace bullying that can happen in fashion, because again, like I said, there's just terrible behavior, but you can pull people up on it. And if you've got a log of when it happens and how it occurs, you've got evidence, and because they're not that bright and they're not thinking that their behavior is wrong, so they're certainly not keeping a diary on their side of when you've got things wrong, because they just think if they do it, you'll stop being a problem, I think. So
do you think keeping a log is actually enough evidence, because it's like that's just something written down, right? You don't
I think if you've got times, I mean, if if there's an email, a screenshot, and send it to yourself on a WhatsApp, they can't access those. So I would say that's the next tool, is screenshotting things and saving them somewhere, not on company hardware, because they can't, I mean, if it goes legal, actually they do have to open those records, by the way. But if it won't even go that far, if you can turn up with a folder full of screenshots, then they will not drag you through a process because you've got proof.
Interesting. So there's another comment saying, in my job, I used to work in conjunction with Purple Space, which is the world's only networking and professional development hub for disabled employees.
Yes,
Network and a
Purple
resource.
Space popped up earlier, actually.
Pardon?
I did see Purple Space pop up in the chat. I was like, oh yeah.
Have you used them?
I haven't actually. I mean, it's kind of one of those on my to-do list of things to do. But like I speak quite a lot to Martin Sibley, who owns Purple Goat Agency, and I think he has something to do with Purple Space. I know he's a lot to do with Disability Horizon. So even if I haven't tapped in on that particular one, I've probably spoken to someone that works within there.
The last sentence of that actually makes sense. Interestingly, it currently looks like there is no corporate members from the fashion world.
Funny that. Well, really, I mean, there should be, because Tommy Hilfiger's had an adaptive range for a really long time, since like 2015. So you would think that they would, but then again, like, Americans actually are far more, like I said earlier, they're more progressive with adaptive wear. So yes, it would be good to have English companies doing it and English board members. It's the next step, hopefully.
Yeah, it's great to highlight this. Really important. I am aware we have run over, so I'm just going to carry on. But thank you for, if everyone is able to stay, that's great. So thank you so much for people who have stayed. So another comment: my sister has very similar health problems, and now finally, because of lockdown, she has proved she can work so well from home. I'm here tonight to try and be the best support I can be for her, which is lovely.
That's really lovely. Good sister.
Yeah, it's great to, it's just, it's proven that you can work from home, and why not, if you want to, having that choice, I think.
Yeah, I think exactly. It should be a choice rather than a dictated, you must be here 5 days a week. I think it should be, well, how do you want to work? Let's try it. If it doesn't work out and, whatever, then agree to be flexible. But I don't think it should be the company's our way or the highway sort of rule. I think, lockdown has proved that actually we're just as productive.
Exactly.
If not more, actually, I think it's been proved that we're more productive at home.
Yeah, I think so too. I don't know if it's like for everyone, but I think a lot of people have proven that it is productive for them, and it works for them, because be productive at home, and that's amazing. Sometimes I can't be, because I like to sleep. I like to be in my and I like Netflix, so that's a bit of a struggle for me, but that's just something that it's my personal problem that I'm working on. And then I work at like weird hours, so yeah, sometimes it doesn't work for me necessarily, but I appreciate it does work a lot for a lot of people, and that's fantastic. Why commute an hour, especially if you've got a disability that just affects things even more, and it just manifests and snowballs. We've got to be like the best version of ourselves in order to be productive and to really thrive in the workplace. Why wouldn't you want that of your employees?
Exactly. When everybody's happier to work more and go the extra mile. Like it really is, everybody wins.
Exactly. I completely agree. Wow. Well, thank you so much, Victoria. This is amazing. So fantastic to chat with you. I'm really, really grateful for your time and for your experiences and everything you shared. I think it's been really, really important to highlight these issues. You know, I've learned a lot, and I'm sure people who are watching have learned a lot too. Yeah, so if you would like to contact Victoria, her details are in the chat, and I will also share them in the email following from this talk. Our final guest speaker will be joining us a week from Friday, so like a week and a half away, so next week. So this is going to be Alison Lowe, MBE. This is a woman. Yeah, this is the woman that we've
in.
Please do. Yeah, so she's the creator of the community little hub that me and Victoria met in, but she's also an incredible woman, really, really inspirational. She's helped so many startup businesses, even businesses that have been in the industry for a long period of time too. You know, in the business side of things, she really helps to support and make them succeed. And yeah, so she received an MBE for the services to the fashion industry. Alison has built a reputation as one of the leading supporters of creative talent and startup businesses. She's renowned for her practical, realistic approach to running a creative business, and has acted as a consultant to brands across the globe, from startups to established businesses. Like I said earlier, this is an incredible woman. So yeah, I'm really looking forward to speaking with her, and I think it's going to be a really wonderful way to round up the talks. And been so grateful for everyone who's tuned in and who's signed up, and the people who have, you know, come back for multiple talks as well. And also it's great to see new faces too. I really hope that everyone's been enjoying the series of talks. As I've said in the previous talks, we've recorded a lot of them, I think nearly all of them, apart from one. And they're going to be on a YouTube channel through Times Change Kingston, which I will share in emails. And if you've missed any of them, then you can catch up there. And also please do share around with other people who didn't manage to make it, who you think might be interested. And yeah, if you would like to visit the virtual exhibition that I mentioned earlier, the link is in the chat too. And it will be running for 1.5 more weeks. Yeah, so that's really, really fantastic. And we're also always looking for Time to Change champions to get involved, like I have. If you're interested in reducing stigma in Kingston through events, activities, and online campaigns, then please do get in touch. You can also become a champion in other areas of London and also the country. You know, I found it an incredible experience volunteering for them, and really campaigning to reduce mental health stigma. It's given me the confidence to talk about my experiences, and they've given me the support to help me do that. And, you know, it's all on my terms when I'm ready, you know, like there's no rush. And again, if anything has upset you during this conversation and you need support, you can call the Samaritans on 116 123 or text shout to 85258. We've added signposting again to, like I said, UK services, Sri Lanka and Mexico. And yeah, there's support out there, so please do look after yourselves and reach out if you need to. Thank you so much, everyone. Thank you so much to Victoria. Yeah, it's been incredible, and I really hope to see everyone a week from Friday. Thank you so much.
Thanks,
Take care.
everyone.
Thank you. Bye.